Thanks, Health Watch. One antidepressant can help women dealing with menopause, and cynics beware. Your attitude can impact your health. Dr. Crystal Foster with the Baylor Healthcare System joins us with today's health headlines. And before we get to those stories, there's a new study that's comparing the life expectancy of smokers and those dealing with mental disorders.
That's true. There's a new study out of Oxford that shows that people who smoke cigarettes, on average, their life expectancy is 8 to 10 years younger than people who don't smoke. Well, this new study actually looked at people who have recurrent mental disorders. So people with recurrent depression, their life expectancy is on average 7 to 11 years shorter than the average person. People who suffer from bipolar disorder and schizophrenia, their average life expectancy can be up to 20 years shorter than the average person. So we always think about, counseling our patients not to smoke, but how often are we thinking as doctors how these mental disorders are going to affect our patients' physical health long term?
Gotcha. Good information there. There's also a new study that's focused on an antidepressant. It can actually help women that are dealing with hot flashes and all those wonderful things you deal with when you go through menopause.
Exactly. So the good thing about this thing, this drug is called Effexor or venlafaxine, is that it does reduce hot flashes as well as night sweats, similar to estrogen. So estrogen therapy used to be the gold standard for women who are going through hot flashes, but a new study shows that estrogen might reduce it by 53% after 8 weeks, venlafaxine can reduce it by 48%. So it's very similarly effective, and it doesn't have the same risk as estrogen replacement after menopause. Estrogen replacement can put you at risk for heart disease, strokes, and certain types of cancers.
Gotcha. Well, that will be relief for a lot of women that I'm sure they're looking for. And there's also, this one's really interesting, mistrust, or I guess paranoia of other people, that can lead to dementia. Is that right?
So this was a very interesting study.
Yeah.
So yes, you agree. So what the study was looking at, it was to see how cynical certain people were. And so if you had a high level of cynicism, if you just really didn't trust other people, were you going to be more likely to develop dementia later on? And this study did show that people with high levels of cynicism were 3 times more likely to develop dementia after 8 years compared to those with low levels of cynicism.
Very interesting.
It's interesting. It's an association, not a cause and effect. But I think it's important to point out that people who have a negative view on life tend to have more negative health consequences.
Good to know. All right. Thank you, Dr. Crystal Foster. Thanks so much for joining us. We're gonna